health experts have been learning more and more about COVID as time has progressed, and a lot of people still wonder, how much impact does COVID, if you get it, have on your heart? Joining us this morning with the insight on that is Dr. Matthew Pflederer. He's a cardiologist with Grandview Medical Center. He joined us this morning by FaceTime. Good to see you this morning, doctor.
Thanks for having me.
Yeah, and as I mentioned, obviously we learned early on that it could impact the heart. But talk about what you have seen, COVID, in terms of its effect on people's hearts, depending on age as well.
Yeah, early on, obviously there was a lot of well-deserved hysteria and fear over the unknown. The reality is the vast majority of COVID cases don't really have any significant impact on the heart. That's what I, saw in my practice as well. Anybody who's hospitalized or critically ill, there's going to be significant stress on the heart. And I would say heart-related complications happened at a slightly higher rate than you would expect, than all comers, in terms of COVID. However, in my experience, the vast majority of the damage from COVID was from the COVID pneumonia and the impact on the lungs.
Obviously, we've been dealing with this in our country we've been dealing with this with our country for what, a year and a half now. So there's still a lot to learn. It's relatively new. I know it seems like a long time for people, but it's still relatively new. And we hear a lot about long COVID, long haulers. Do we know enough, though, from this year and a half or whatever it's been now, to know about that, the long-term effects?
Long COVID or long haulers, as we call them, has been a really one of the most challenging things about COVID. It was a clinical interest of mine early on, and I had established a clinic where I saw, over 100 of these patients who had heart-related symptoms. And sadly, we just have not learned much about it. Acute COVID infection, there's a lot more black and white from the testing and so forth. However, long COVID is very vague. Now, this isn't totally unique to COVID. We've seen long progressive symptoms after other infections. Lyme disease would be an example, and other viruses. The sad part is a lot of these patients get looked by other providers, and a lot of the patients I saw, really felt shunned by the medical system. So we have to take their symptoms very seriously.
Sure, absolutely.
Unfortunately, it's hard to treat.
We know through Operation Warp Speed that several scientists, researchers got together trying to develop these vaccines, and there were concerns over some side effects reports early on that the vaccine might impact people with inflammation of the heart condition. Talk about that, and how much data is there that it actually does cause that condition, and even if it does, how soon somebody can recover?
Yeah, aside from side effects of the vaccine, myocarditis is one of the few, real legitimate medical complications of the vaccine that's come about. We started noticing a couple months ago, and especially in the age group males between the age of 16 to 30, where it was pretty clearly related to the vaccine. And, this condition can be pretty scary when you have severe chest pain and enzyme release that looks like a heart attack. Thankfully, the bark is usually worse than the bite, and even though the testing can look really bad, these patients have recovered pretty well. But it's happening in about 1 in 50,000 people in this age group.
Okay. So it is a very, very, very low number there. Well, let me ask you finally, doctor, and I don't know if you can speak to this, but you're there at the hospital, you're treating your patients, and you're a different area of the hospital. It's a very big facility, we know that. But we've heard from a lot of hospitals and some of their leaders that they're starting to get more patients. It's beginning to become a bit of a concern. Listen, I know this is not your ward, but what are you seeing, what are you hearing about your hospital in terms of the number of COVID patients they are treating right now?
Yeah, there's no doubt hospitalizations are on the rise, and we've all got COVID fatigue. I mean, I'm just as sad as anybody that this is back, but the reality is it is, and all over the city and all over the Southeast, there's no doubt hospitalizations are way up over the last few weeks.
All right, that is Dr. Matthew Pflederer. He's a cardiologist with Grandview Medical. We appreciate your time and lending your expertise this morning. Thank you so much, sir.
Thanks for having me.
All right, JJ.